Hi everyone and welcome back to my channel Stuck in the Mud. Today I'm going to be talking about metacognitive therapy, which has been instrumental in helping me get better from OCD and anxiety. It's something I've worked on a lot in the last probably 5 to 10 years in being consistent with, because I found it's been probably the most helpful treatment for my OCD. And it's something you don't actually hear a lot about, because we often hear about cognitive behavioural therapy and the gold standard, which is exposure and response prevention. And I'm not taking anything away from those because they can be really successful too. Everyone's different and everyone responds differently. I've often found exposure and response prevention is great too, and I often use elements of that as well. But you don't really hear a lot about this one, which is metacognitive therapy. And I found it has been really effective for me. So metacognitive therapy changes our relationship with thoughts and how we think about them. So it's actually been researched that it's quite effective for a lot of mental health conditions. And I'm going to break it down in a more simpler way because I don't think it's really probably helpful to get too technical about this, because one, I'm not a therapist, and two, it's hard to understand maybe if you get too technical. And also, if you want to find that information out, you can look online. But I want to say how it did help me. The aim with OCD is to recognize, be aware, and use skills to change our metacognitive processing. And the technique used is Detached mindfulness, and this has been amazing for me. It sounds so simple, and I'm going to break it down really simply, but we don't get involved with our thoughts. We see them as separate from ourselves, because I remember when my therapist did this with me, my psychologist, I often thought, this is just too simple. How could this possibly work? It's just too simple. How is this going to be effective? And let me tell you, the more and more I practiced this and the more consistent I was in carrying out detached mindfulness, the better I got. And I really did get so much better with this. So we often get intrusive thoughts with OCD, and it pulls us in, and we like to get involved with them and try and rationalize them and investigate them. And that in itself will lead to more rumination. We can worry about these thoughts. We can suppress them, try neutralizing them with their compulsions. And all that is going to do is perpetuate the cycle. So with detached mindfulness, you're being aware of the thoughts. You can be aware of them arising in your mind, and anything like feelings, memories, beliefs, sensations. And the detachment means just not engaging with it, just let it be there, because we can have all these thoughts arising and we don't have to latch onto them and get involved with them. And that sounds impossible for anyone with OCD. I get it. I've been there myself, and for a while it just felt like, I got involved with it again. And I started to be quite down on myself about it, because I'm very aware of when the thought pops up and I can kind of sense it there. But then, because we're so well rehearsed in what we do with OCD, we often are very quick to get involved with it and also engage in compulsions, or even just maybe get involved with it and you don't even know you're doing it. It's like almost automatic pilot. We're just automatic thoughts. We're just getting involved with the thought. We're lost down that rabbit hole again, and we're just perpetuating that cycle. So once I became more aware and I did it more consistently, it did get easier and easier. So we are not our thoughts. They arise and we don't have to get involved with them. And that was kind of like a breakthrough moment. I'm thinking, wow, So I am not my thoughts. I see them as separate from myself. They just arise. And once I did that, I noticed that I wasn't getting the same kind of feelings from them. I would just see them as that. They are just thoughts. They have no effect on me, my life. They are just there. And this is, it's so hard. I know it is. It's not an easy thing. It's easy for someone to say, oh, just let them be there. But it really does work. And it's just seeing them for what they are. They are just thoughts. We don't have to latch onto them. We don't have to get involved with them. And I did get better, a lot better. And the more I practiced this, the easier it got to do. And I found that I wasn't getting intrusive thoughts as much. They weren't as regular, but also even if I did get them, they wouldn't bother me. And that is the key thing. They don't bother you the same. Once you treat them for what they are, they're just thoughts. You don't feel that same sense of panic or guilt, shame, all these other things we get when we have OCD. It just makes them seem just that. They're just thoughts. They don't mean anything to us. It doesn't say anything about me. And it's like, it almost like releases you from that kind of cycle that we've probably built up over years. And it changes that processing that, maybe we are wired a bit differently with OCD, and it changes those little pathways that maybe have kind of ruled our life for years. So you can get more technical with this and look at the different elements of metacognitive therapy, which includes thought event fusion, thought action fusion, and thought object fusion. And like I say, I'm not going to get too involved in that because I want everyone to treat thoughts just as that. They're just thoughts. And it can get a bit more confusing, I think, if we get too technical. But when we break it down, we are not our thoughts. So we often get thoughts with OCD and we'll get scared by them. You'll feel a lot of fear, and we're involved at that point because we've kind of grabbed onto it. So with this therapy, it's just seeing it as detached from us. It's not us, we are so much more than our thoughts. So once I could separate myself from that, I felt like things were just getting easier for me. And I did feel like this could be the right treatment for me because I was living my life much more normally. I wasn't getting bogged down with the thoughts. I was just seeing them for what they are, and they're not important, because when we latch onto the thoughts, we give them importance, which then perpetuates the OCD cycle. And it's not helpful because we end up getting sucked in again. And so I think it's important as well to be kind to yourself in this therapy, and just, if we find we're getting pulled in again, it's just like, it's okay. I know you're there. You can do whatever you want. And I think it's important as well to say that when we get those intrusive thoughts, that even if they come out all singing, dancing, jazz hands, trying to get our attention, it's just let them do whatever they want to do. But you don't have to give it the attention it wants, it craves, because OCD just craves that attention from you. And if we don't give it, it's like I say, starving the monster, starving the OCD. It'll just give up, and your intrusions will become less. And it's a really positive therapy, and it's something, like I say, you don't really hear a lot about, and I have found it so good for me. So if this helps you at all, it'll be great to hear. Maybe if you want to find out more about it, you could speak to someone and, like I say, research online, speak to your psychologist, therapist, and it's something you could explore more. But it has been really instrumental in me, functioning again and, just living a normal life, because for a long time I was engaging with the thoughts more than I even realised. And I think once I became aware with how much I engage with these thoughts and how much I believe them, and I honestly was so sucked in, thinking you think a thought, you think it's true, whereas most people get intrusions, but they do just that. They're just, I guess, wired differently, and they can just dismiss them as just a thought. But for people that struggle with obsessive compulsive disorder, we tend to get involved, and then the whole rumination starts, the worry, and we'll start questioning, what that does this say about me? What if I'm capable of doing this? And we're not. It's, they can feel like urges, they can feel like sensations, and they're just thoughts. All of that is thoughts. And if we can just really break that down to that point where we're becoming aware that all these things are just thoughts, they won't affect us in the same way. So the therapist doing this kind of therapy will often ask you to bring on an intrusive thought. This is what my therapist often did with me. So it should get me to think of a really uncomfortable, intrusive thought and just not get involved with it. And she'd leave the room for a few minutes, and then she'll come back and see how I got on. And it was such a weird thing, because I could be aware of it, and and that's fine, being aware of it, being there, but just not getting involved with it was surprisingly easier than I thought, and I knew I was capable of doing this. And, it became a practice that that I just engaged with more and more and more, and became more aware of my thoughts and how they adjust that. They don't say anything about me. They don't mean anything. And I found it was easier to disconnect from that. It's also important not to fight your thoughts, because I hear it too often, and I see it online, and people just giving out the wrong advice. And it's really harmful to people with OCD, because trying to change your thoughts is just going to perpetuate the cycle. People will say, well, just don't think about it, or think happy thoughts, or it just doesn't work, and it'll just perpetuate the OCD. It's like if someone says to you, don't think of a pink elephant, what are you going to do? You're going to think of a pink elephant probably again and again and again on a loop, because the moment someone tells you not to do something, it just, it perpetuates it. So there's different techniques people use for this. So some people might see the thoughts as clouds passing in the sky, and that is one that's been quite helpful for me. My therapist often used with me also a technique for when I got an intrusive thought is think of it like a toddler having a temper tantrum, trying to get your attention. And you don't have to give in to the tantrum, you don't have to. It's just, think of this thought just having a toddler tantrum and just disengage with it. It's okay, it can still be happening, but you don't have to be involved with that. And those little scenarios are different things you can do. You can think of it as like a train, coming in the station, but you don't have to get on that train. There's just a few little examples there of things you can do to disengage with the thought and not get involved with it, because that's where the problem starts. And these are just little tools to help just see your thoughts differently, and just see them as passing clouds or passing trains or toddler tantrums. They're all really helpful in recognizing when these intrusive thoughts happen and what you can do to stay away from that and not get involved. So I hope this video has been helpful for you in getting your power back from OCD, and just treating thoughts as just that. They are just thoughts. We are not our thoughts. You are so much more than that. And I hope these videos are going to help you see that. I'm going to have lots more videos coming up. Please let me know if metacognitive therapy is something you've tried, or it's something you're thinking of exploring further. And I'll see you next time.